The female reproductive system is an intricate network of organs and structures primarily responsible for reproduction, sexual function, and hormonal regulation. Here's a comprehensive overview of its anatomy, physiology, functions, and common disorders. The female reproductive system can be divided into two main parts: the external genitalia and the internal reproductive organs. Mons pubis, the fatty tissue located above the pubic bone, covered with pubic hair after puberty. Labia majora, the outer folds of skin that protect the internal structures. Labia minora, the inner folds of skin, which are thinner and more sensitive than the labia majora. Clitoris, a small sensitive organ located at the top of the vulva, primarily responsible for sexual arousal. Urethral opening, the opening through which urine is expelled from the bladder, vaginal opening. The entrance to the vagina, which leads to the internal reproductive organs. Vagina, a muscular tube that connects the external genitalia to the uterus. It serves as the birth canal during childbirth and as the passage for menstrual fluid and sexual intercourse. Uterus, a hollow muscular organ where a fertilized egg implants and develops during pregnancy. It has 3 layers. Endometrium, the inner lining that thickens during the menstrual cycle and is shed during menstruation if fertilization does not occur. Myometrium, the middle layer of smooth muscle responsible for uterine contractions. Perimetrium, the outermost layer that covers the uterus. Fallopian tubes, 2 tubes that extend from the uterus toward the ovaries. They are the site of fertilization, where sperm meets the egg. Ovaries, 2 almond-shaped organs that produce eggs, ova, and secrete hormones, estrogen and progesterone. Each ovary contains follicles, which mature into eggs. Cervix, the lower part of the uterus that opens into the vagina. It has a canal that allows the passage of menstrual fluid, sperm, and during childbirth, the baby. The physiology of the female reproductive system is truly fascinating. Let's delve into the menstrual cycle first. This is the regular cycle of hormonal changes that prepares the body for potential pregnancy, typically lasting about 28 days. It includes several phases. First, the menstrual phase, where the endometrial lining is shed. Next, we have the follicular phase. During this phase, the follicle-stimulating hormone, or FSH, stimulates follicle development and estrogen production. Then comes ovulation. This is the release of a mature egg from the ovary, triggered by a surge in luteinizing hormone, or LH. Following ovulation is the luteal phase. Here, the corpus luteum forms from the ruptured follicle and produces progesterone to support the endometrium. Now, if we talk about fertilization, it occurs in the fallopian tubes when a sperm cell successfully penetrates and fertilizes an egg. If fertilization happens, the fertilized egg, known as a zygote, travels to the uterus, where it implants in the endometrium. And finally, pregnancy, which typically lasts about 40 weeks, begins. Hormonal regulation. The hypothalamus, pituitary gland, ovaries, and uterus work together through a feedback loop involving hormones such as estrogen, which promotes the development of female secondary sexual characteristics and regulates the menstrual cycle. Progesterone prepares the endometrium for potential implantation and maintains pregnancy. Follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH, regulate the menstrual cycle and ovulation. Functions of the female reproductive system include the production of eggs, where the ovaries produce and release eggs during ovulation. The system also regulates the menstrual cycle, preparing the body for potential pregnancy. Additionally, it facilitates fertilization and supports fetal development during pregnancy. Childbirth is another function, allowing for the passage of the baby during delivery. Lastly, it contributes to sexual arousal and pleasure. Common disorders of the female reproductive system include menstrual disorders like dysmenorrhea, which is painful menstruation, and amenorrhea, the absence of menstruation. Menorrhagia refers to heavy or prolonged menstrual bleeding. Polycystic ovary syndrome, or PCOS, is a hormonal disorder causing irregular periods, excess androgen, and polycystic ovaries. Endometriosis is a condition where tissue similar to the endometrium grows outside the uterus, causing pain and fertility issues. Uterine fibroids are non-cancerous growths in the uterus that can cause heavy bleeding and discomfort. Pelvic inflammatory disease, or PID, is an infection of the reproductive organs, often caused by sexually transmitted infections, or STIs. Ovarian cysts are fluid-filled sacs on the ovaries that can cause pain or discomfort. Cervical cancer occurs in the cervix and is often linked to human papillomavirus, or HPV, infection. Infertility, the inability to conceive after 1 year of unprotected intercourse, can result from various factors including hormonal imbalances, anatomical issues, or age. Maintaining reproductive health involves regular checkups, such as routine gynecological exams and Pap smears, to help detect abnormalities early. A healthy lifestyle, including a balanced diet, regular exercise, and maintaining a healthy weight, can positively influence reproductive health. Practicing safe sex and getting tested for STIs can reduce the risk of infections and other complications. Understanding and managing hormonal health can aid in menstrual cycle regulation and overall well-being. Staying informed about reproductive health, menstrual cycles, and changes in one's body is crucial for proactive health management. The female reproductive system is essential for reproduction, hormonal balance, and overall health. Understanding its anatomy, physiology, and functions can help women make informed choices about their health and well-being. Awareness of common disorders and preventive measures plays a crucial role in maintaining reproductive health throughout life.